Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. On our program today, we're going to be talking about well woman care and screenings, top health concerns, just what should a woman be thinking about over her lifespan. And joining us to do that is board-certified gynecologist, obstetrician, Dr. Peter Tseng. Dr. Tseng is also physician in well woman's care. Dr. Tseng, welcome to Today's Health.
Thank you for having me.
What is well woman care?
Well woman care is a way for women to get some preventative care, for women who want a convenient way to do this all sometimes in one visit, and this can include things like pelvic exams, pap smear tests, mammograms, bone density tests, and these kinds of things. And we try to individualize with each woman's situation to determine, what tests would be appropriate. And we use things like a woman's age, background, and their current situation to determine this. And we try to just make it a very comfortable and convenient way for women to take care of these things.
So who would benefit from well woman care?
Well, really just about any woman. Most women who just want their routine tests, who want to maintain their health, and it's probably not the best for women who are having big problems requiring surgery, for instance, but mostly just more the preventative types of care. And again, any woman who wants a convenient way to do that.
Right, because you can get it all done one day. You can get yourself organized, and if you know you need a mammogram and lab work, and
most of the time we could try to combine them all.
Try to organize it. Do most of your patients also have a primary care?
Yes, I would say most women do, and a lot of primary care physicians will send their patients to me for this type of care, their gynecologic care, pelvic exam, breast exam, and it's nice for them that they can also do the mammogram at the same time if that is warranted. And I try to communicate with their primary care doctor, sending them my notes, also any test results that I do as well.
What are the typical components of a physical exam that you would do?
Well, we usually start by actually going over their history first and looking at their past history, their surgical history, their family's history. We try to identify what their situation is, what risk factors they might have. Then we usually do a physical exam, a pretty complete exam, including height, weight, blood pressure, checking the head and neck, chest and lungs, heart, again, breast exam, abdominal exam, pelvic exam, and we usually do a rectal exam, especially over the age of 40, and a general skin exam as well.
If you do other tests, like do you sometimes order lab tests or other tests while a patient is there?
I don't do a lot of blood work, especially if they have a primary care physician. Most of the time I don't want to be duplicating things that they have done, but I have some women who don't have a primary care physician, and they're healthy, and so I will do some routine blood work, and this could include things like a cholesterol, general chemistry panel, blood sugar, blood count, and things like that. But most women I have, or a lot of their blood work, routine blood work, is done through their primary care doctor.
So then how do you communicate the results of any testing you might do to these women?
Most of the time I have a copy sent to their primary care provider. My notes, especially if they're on staff with McLaren Port Huron, it's easy to get my notes and test results to them. And there are some situations where I would call them if they had specific problems that needed to be addressed. But most of the time it's by sending notes and the test results directly to them.
And to the patients, do you usually call them, or do you usually send them a copy? What can they expect?
I like to call my patients with test results. Certain things like the mammogram, typically there will be a letter sent from the hospital. Test results like pap smear tests or blood work or bone density tests, I usually will call the patient myself.
And are there ever return visits? Like, do you ever have to ask a patient, you know, we found this, can you come back?
Yes, most of my patients are here for just the routine exam, and most of the women, that would be once a year. But yes, if we find a condition that needs some follow-up, then most of the time I can do that. And then there are a few in-office procedures that I would do in certain situations as well. But most women I tend to see once a year just for their routine annual exam.
And how do you make an appointment to see you in Well Women's Care?
Well, there's some different ways. Most women can call the Women's Wellness Place at McLaren, Port Huron. Another way would be to do it through their primary care physician, and often their primary care provider will set up the appointment to see me as well.
Thanks. It sounds like a great service, a great program. We're going to take a break, and then we'll be back and talk about more screenings.